Some medical professionals tell their patients with hearing loss not to get hearing aids because they don't work. So in this video, I'm going to take a look at hearing aids and see if they're a viable option to treat your hearing loss. Coming up. Hey guys, Cliff Olson, Doctor of Audiology and founder of Applied Hearing Solutions in Phoenix, Arizona. And on this channel, I cover a bunch of hearing-related information to help make you a better informed consumer. So if you're into that, make sure you hit that subscribe button. And don't forget to click the bell to receive a notification every time I post a new video. There is some speculation out there as to whether or not hearing aids are an effective treatment option for hearing loss. In fact, there are some individuals out there who do not believe that hearing aids work at all, and that the best way to treat your hearing loss is to just deal with it. So let's explore the question, are hearing aids effective at treating hearing loss? First, let's start by discussing the different causes of hearing loss. You have earwax or foreign bodies, genetic causes, noise exposure, chemical exposure, age, head trauma, autoimmune conditions, tumors, and other medical conditions like Meniere's disease and otosclerosis. All of these causes lead to one of only 3 different types of hearing loss. You have sensorineural, you have conductive, and you have mixed, which is a combination of the two. Over 90% of hearing losses are considered sensorineural, which means that there's either damage to your cochlea, which is your hearing organ, or the auditory nerve that takes sound from the cochlea up to your brain. This is a typical audiogram configuration of a sensorineural hearing loss. The key characteristic of this type of loss is having the angle and square brackets in close proximity to the X's and O's on the graph. No matter where the X's and O's are on the graph, if the brackets follow them, this is most likely the type of hearing loss that you have. Without getting into too much detail, the reason that sensorineural hearing loss is so common is that the causes of sensorineural hearing loss typically damage the inner and outer hair cells inside of the cochlea. The outer hair cells, which are usually the first ones to go, are responsible for amplifying sounds coming into the cochlea naturally, so those sounds can actually make it up to the brain. This is why hearing aids are so effective and are the primary treatment option for individuals with sensorineural hearing loss. Because hearing aids can create additional vibration at the specific frequency ranges of your hearing loss, so you can replace the sounds that you're missing. If we take a look at the audiogram again, we can plot the speech sounds that we call phonemes on this graph as well. Any sounds above the X's and the O's on this graph in the shaded gray area are not able to make it from the ears to the brain. This is why getting clarity in speech is so difficult with an untreated hearing loss. However, hearing aids do a very good job of amplifying these sounds to make them accessible to your brain again if, and this is a big if, your hearing aids are programmed correctly. The best and only way to ensure that your hearing aids are programmed correctly to your hearing loss prescription is to have real ear measurement performed on them. Now, if you don't know what real ear measurement is, I highly recommend that you check out my video that I will link in the description. Now, there is another factor that will determine how much success you have with hearing aids if they've been programmed correctly, and that is your word recognition score. Just because we replace this sound back to your brain does not mean that your brain will actually understand it. Your ability to actually understand words lies more with the inner hair cells inside of the cochlea. If they have a lot of damage, it's usually going to distort the information that makes it from your cochlea up to your brain. If you have good word recognition scores, then you should expect to do well with hearing aids. However, if you have really low word recognition scores, hearing aids become much less effective. In some cases of sensorineural hearing loss, a cochlear implant may be required. A cochlear implant, like the name suggests, is an implant that actually bypasses the inner and outer hair cells inside of your cochlea and provides electrical impulses to the auditory nerve directly, so those signals can actually make it to your brain. Cochlear implants are absolutely medical miracles that can restore hearing ability when hearing aids aren't enough. And if your hearing care professional identifies that you're just not going to do well with hearing aids, they should be recommending that you go see a cochlear implant specialist. In general, traditional hearing aids are also not the best option for conductive hearing losses. Conductive hearing losses are when your X's and O's indicate a hearing loss, but your brackets show that your cochlea has the ability to hear in your normal range of hearing. indicating that there could be an obstruction or medical condition that blocks the natural vibration of sound entering your ear, preventing this vibration from reaching your cochlea. In most of these situations, traditional hearing aids are not the most effective treatment option. Instead, conductive hearing losses usually require earwax removal, foreign body removal, surgery to correct a medical condition, or a bone-anchored hearing aid, which can send vibration that bypasses the outer and middle ear and can stimulate a healthy cochlea. Mixed hearing losses sometimes require the combination of medical intervention and hearing aids to successfully treat. While there are different types of hearing loss that may or may not receive benefit with hearing aids, the vast majority of individuals with hearing loss can receive an immense amount of benefit when they use hearing devices. So if you're having difficulty hearing, make sure that you reach out to a hearing care professional to identify whether or not your type of hearing loss can be best treated with hearing aids. That's it for this video. If you have any questions, leave them in the comment section below. If you liked the video, please share it. And if you want to see other videos just like this one, go ahead and hit that subscribe button. Also, feel free to check out my website, drcliffAUD.com.